Hello, everybody. I've got a bit of a serious talk for you today. It's about cancer, right? So, as I get through some of the concepts, I'll kind of share a little bit of my story, all right? So, I recently had a little scare, all right? So, I go to the doc and I had a swelling, a mass, all right? And I'm a biologist. So I typically know that, something like this is one of two things, right? Either you have an infection or a tumor of some sort, okay? So I had a heads up going into this, okay? So we go in there and the doctor was a little bit alarmed, saying, same thing that, obviously he's a doc, so he knows the same thing I know, and then some, right? So right away, he wanted to see if we can eliminate the infection part of the equation. So he prescribed antibiotics and said, see you in 5 days or whatever. Okay. So let me give you some background here. When you have an infection, like staph, that's a great example, right? Staph, or bubonic plague. There's another one. You tend to get things that swell up on you, right? Like a staph infection might give you like a boil, whether it's on your face or your arm. It looks like a big pimple, right? That's a staph infection. Or in the case of bubonic plague, back in the day, right? Your lymph nodes would swell up, and you have lymph nodes on your face, your cheek, your neck, right here, your armpits, your chest. So your lymph nodes would swell up real big, okay? And in fact, that's called a bubo. A little fun fact: when the lymph node swells up, like when you get a really bad flu and you kind of poke and it hurts, it's called a bubo. Hence where the term bubonic plague comes from. So yeah, that my doc was kind of curious. Do you have like an inflamed lymph node from an infection? Do you have maybe some kind of like sebaceous, infection? Again, something bacterial. Okay. So terms here. There you can see bubo, like staph, right? So he wanted to eliminate something along those lines, right? So puts me on antibiotics, like I said. Come back a few days later. No change, right? No change whatsoever. And at this point, he was like, "Dude, we've got to diagnose this the right way and take care of you the right way." So immediately, I'm sent out to do a little imaging. In this case, a CT or a CAT scan. So what a CAT scan can do that X-rays can't do is that it picks up on soft tissues. Okay, as opposed to, again, X-rays, which are good for bones, that kind of thing, hard tissues, right? So they stuck me into the CAT scan, and I think he was really worried that I was going to come back and be positive, like be full of tumors in my throat or sinuses or something along those lines. So right away, good news, nothing had spread, right? Nothing in my sinuses or throat or whatever, nothing in my head. Except for what he found, right? So he sent me over to an oncologist. That was the next thing. And I'll tell you what's a little bit alarming, or what causes anxiety in these situations. When they send you to an oncologist, a cancer doc, if you will, you can't get your appointment in for another month or so. So you have like a whole, in my case, like, about 3 weeks of just waiting. So finally, I'm able to get in. I see the oncologist, and the next thing is they have to do a biopsy. So that's where they take a little sample of that tissue, and they obviously send it off to a lab, and they're looking it over. Okay, so diagnosing, again, the CT in my case, followed up by the biopsy. And who does that? The oncologist, which is a cancer doc. So at this point of the lesson, I should probably back up for just a second or two, and I want to be kind of clear, like, what exactly is a tumor, or more specifically, what is cancer, okay? So it's a mutation of a body cell or a somatic cell. So just think like if I'm in the sun, I get a bad sunburn, now there's a potential for mutations in my skin cells, right? Skin cancer in that case. So when you have a mutation of a somatic or body cell where it can divide and grow, right? that initial mutation is called an oncogene. Oncogene, hence why the doctor is called an oncologist, right? So there you have what exactly is cancer. Specifically, it is the oncogene, okay? Now, of course, continuing with that part of the discussion, what exactly causes oncogenes? What causes cancer? Okay, so it's kind of a combination of two main factors. I'm kind of being generic here, but a combination of two main factors. Genetics, almost everything is genetic, right? So like you take breast cancer, for example, and you've heard of, like the BRCA1 gene and the BRCA2 genes, which are definitely linked with breast cancer. So there's an aspect that is hereditary, okay? Now the other side of the coin would be something called carcinogens, okay? Carcinogens. So now, what exactly are carcinogens? Carcinogens are substances that are known, or at least suspected, right, to induce mutations, to cause oncogenes to occur. And you've heard of several of these. Some of these pop up on various commercials, like for like lawyers and whatever. So I'll just kind of run through some of them that you've heard of, just to kind of lay a foundation for you, okay? Asbestos. Asbestos was used in insulation back in the 60s and 70s. It is linked with a specific type of lung cancer called mesothelioma. Various types of pesticides are linked with things like non-Hodgkin's lymphoma, which is a type of blood cancer. Certain plastics, one of them that perhaps you've heard of, that we'll talk more about in class for sure, BPA, right? That's linked with many types of reproductive cancers, such as prostate cancer in men. And I could go on and on and on. I mentioned, sun and ultraviolet radiation, radon, many metals, mercury, lead, cadmium. So again, here's my quick list: cigarette smoke, burnt food. I mean, we could go on and on. Okay, but these are just a few out of probably like tens of thousands. Like my father once said, half jokingly, everything causes cancer nowadays. And yeah, that was half joking, but you look on the warning labels at, stuff at your hardware store, and the warning causes, suspected to cause cancer and this, that, and the other. Like caulk, be careful. Don't put it in your mouth, you know what I'm saying? So anyways, focus mentally, back to the lesson here. So, one of the sayings that I like to use when I talk about the environment and ecology, I oftentimes say the environment out there is the same as the one within. So when humankind puts various toxins, mercury, lead, cadmium, like I alluded to earlier, when you put that out in the environment and it affects species, you need to realize those same things that affect the species out there also affect us. And specifically here for this lesson today, they oftentimes are linked with cancer. So there was my quote. There you go. The environment out there is the one within as well. So what we put in the environment is the same stuff we oftentimes put into our own bodies by our lifestyle, by our diet, etc., etc. Okay? Now, when cancer takes root, okay, and it starts to spread, the spreading of cancer is called metastasis. So when the doctor says the cancer has metastasized, like if you're watching House or ER or any of these other, medical dramas and whatnot, the term metastasis refers to this spreading. So cancer is going to divide, just like skin cells or any cell in your body divides through a process called mitosis. Cancer also is going through mitosis. We just call it metastasis, okay? And the thing that's most alarming is those skin cells, or the cancerous cells, as they dislodge, they can end up in your bloodstream. They can end up in your lymph vessels, your lymph nodes, and travel elsewhere in your body. So like take for example, breast cancer. A woman with breast cancer can have tumors that are found in her lungs and other parts of the body, which obviously originated as a result of breast cancer, okay? Now your body, in my body, everyone's body, has defense mechanisms And the main one is something called the P53 gene. So the P53 gene is what regulates each cell in our bodies, okay? So if it notices, like it's a little person, if he or she notices that there's a mutation, an oncogene in that cell, it causes the cell to like self-terminate itself. That's a process called apoptosis. So the P53 gene is looking at cells to see if there's a mutation, and it causes them to undergo apoptosis. That way the mutated cell will never divide. It will never metastasize. It stops there. Unfortunately, the P53 gene doesn't always work, or maybe it has its own mutation. Okay. Of course, we also have antioxidants. Yes, Mom, that's for you. Antioxidants. Sometimes people refer to them as superfoods, green tea, berries, spinach, things that help your body rid themselves of toxins and free radicals, right? And things that are really good on your liver as well. Because your liver, oh my gosh, that's like the most underrated organ in the body, the liver. The job of the liver is just to filter out all the toxins. That's its job. So there you go, the P53 gene and antioxidants, or of course, superfoods. Okay, kind of on the home stretch here, treatments. And you've all heard of chemotherapy. So this is chemical therapy, drug therapy, if you will. The main target of chemotherapy is that it goes after rapidly dividing cells. Now, the problem with that is that rapidly dividing cells also include things like hair follicles, right? So what's the number one side effect that we've all seen over and over again through day-to-day lives and on TV or whatever the case is? You've seen people lose their hair. So that's a side effect because your hair follicles are rapidly dividing cells. So the chemo, the body can't tell the difference between cancer and, in this case, the hair. Okay. Another treatment of sorts would be blood transfusions because your platelets are low, that kind of thing in many cases. So a lot of cancer patients have to go and get blood transfusions. So I wanted to bring that up for a moment here for one important reason. When you have the opportunity to donate blood, please consider it. Please consider donating blood. Because yes, blood is important for people who are in traumatic accidents and whatnot, but it also helps out people who are going through cancer, the worst, darkest time of their life. Okay? So you'll notice there's a date in October for our upcoming blood drive on campus. Please consider donating. All right? Thank you. And lastly, I wanted to kind of get back to my story. So, my biopsy came in, and, knock on wood, fingers crossed, I do have a tumor. I'm going to have surgery. I'll deal with that. But it is non-malignant. In other words, it is benign. So I feel like I really kind of dodged a bullet there. I look at life a little bit differently, but on a really serious note, I know there are people in our lives, and those people perhaps, who are going through those hard times, and they need blood, they need your love, they need your support, and they need your prayers. So that's about it. That's my talk on cancer. I wanted to kind of put some of the vocabulary into effect for you. So this is what I'm going through. This is my type of tumor, and again, it is benign. So that was it, man. Like I told you, a little bit longer than some of my other videos, but that's it, guys. God bless you. Peace out, and see you soon. Bye-bye.